At 4 in the morning, you're awakened by a sharp pain in your wrist. When you're at work, you find that just holding on to a pencil is both difficult and painful. Your hand begins to feel. So what's wrong with you? Is it arthritis, bursitis, or is it just your imagination? No, this is not a dream. Right now your hand is tingling, your thumb and index fingers hurt, and you can't seem to flex your thumb like you used to. What you feel is real discomfort caused by what is known as carpal tunnel syndrome, or CTS. Carpal tunnel syndrome is a common condition that can hinder your hand movements and cause a great deal of pain. It occurs when too much pressure is put on the median nerve that runs through your wrist. CTS is not only very painful, but it may be disabling as well. In order to have a better idea of what we mean, let's take a quick look at the anatomy of your hand and wrist. Turn your hand palm side up. Now place the fingers of your other hand at the sides of your wrist. You can feel the bones along the sides of the wrist. These are just 2 of the 8 carpal bones that form the U-shaped tunnel in your wrist. These bones form the rigid floor and sides of the carpal tunnel. The roof of the tunnel is formed by a very strong ligament known as the transverse carpal ligament. This ligament is attached at the top of the 2 outside carpal bones. It's one of the strongest ligaments in your body, almost as tough as bone. Running through the carpal tunnel are 9 flexor tendons, which allow you to open and close your fist, to move each of your fingers, and to flex your wrist. Finally, in the center of these tendons is a large nerve called the median nerve. It carries sensation from your fingers and hand all the way up your arm and into your central nervous system. The median nerve is the softest and most vulnerable part of the carpal tunnel, and is the source of the pain and tingling associated with carpal tunnel syndrome. To put it simply, CTS is caused by pinching or compressing the median nerve in your wrist. So just what causes CTS? Well, there are many possibilities, and let's take a look at some of them. First, previous dislocation or fracture of the wrist. If you fractured your wrist at an early age, chances are that your wrist may have a different configuration today. Even though the bones have been reset and properly healed, they may be slightly larger than normal and protrude into the carpal tunnel. This leaves less available room for the tendons and median nerve. Second, fluid retention or edema. Excess water in the body may create swelling of the tissues inside the carpal tunnel. Sometimes even the median nerve itself will swell. This type of CTS occurs most often during pregnancy and usually ends after the baby is born. Third, aging. Generally, the soft linings of the 9 flexor tendons become thick and rough with age. This swelling of the fibrous linings creates less room for the tendons and the median nerve, causing the nerve to be pushed against the carpal ligament of the hand. And fourth, wear and tear caused by repetitive movements. If your job requires you to spend hours moving your hands the same way, chances are you're unknowingly damaging the tendons and nerves in your wrist. Okay, so what can you do to prevent carpal tunnel syndrome? How can you reduce further damage to the delicate structure of your wrist? Here are several ways. Number 1, keep your wrist in neutral. That is, keep your wrist in a straight line with your arm when you use it. Don't twist or flex your wrist for long periods of time. Remember, if you feel any pain while flexing your wrist, you're probably doing some damage as well. 2. Use all of your hand to grip an object. Don't pick up a heavy object with just your thumb and index finger. You'll find that your gripping power is much stronger when you use all of your fingers and your whole hand when you pick something up. Don't try to carry too much in just one hand. You'll strain your wrist and your fingers by doing so. 3. Avoid repetitive movements if possible. No matter what type of job you're performing, if you move your wrist in the same way for hours at a time, you're asking for trouble. Don't hold any object in the same way for long periods of time. 4. Rest your hands. Give your ligaments and tendons a rest from time to time. If this is impossible, try to alternate tasks or switch hands. 5. Slow down. Use less force. By not working so hard or so fast, you give your wrist time to recover before working again. If possible, try to find ways to reduce your effort without decreasing your productivity. Power tools are a good example of how you can save wear and tear on your wrist and still get your work done. 6. Exercise. Certain exercises can help to strengthen your hand and arm muscles. Remember that weak muscles are more prone to injury and pain. Your doctor can help by suggesting the proper exercises for you. 7. Ask your supervisor. Your company may have certain suggestions and policies for you to follow. They may provide you with ways to make your job easier. And 8. Be aware of the risks at home. You can injure your wrist even after the workday has ended. Think about the tasks you do at home, or even how you spend your leisure time. Did you just spend the weekend painting the hallway with a paintbrush? That's a lot of repetitive up and down wrist motion. Did you spend hours in the easy chair reading that paperback novel? If so, you probably held your wrist in one position for a long period of time. Did you spend hours playing tennis or casting a fishing line? Think about how you may have twisted your wrist. Did you try to carry too many plastic bags full of groceries in one hand? The pain in your fingers was just a reminder. What happens if your wrist still hurts, even after everything you've done? At that point, it's time to see a doctor. Early diagnosis is the key to relief from carpal pain. It's very important that an accurate diagnosis is given because the treatment for CTS is very specific. By seeing your doctor soon after you experience pain, you may be able to prevent any permanent damage. What will your doctor need to know? Well, it's very important to tell your doctor as much as you can about your situation. Is there tingling, pain, or numbness? Is it just in your fingers or throughout your whole hand? Do you experience pain during the day, or does the pain wake you up during the night? Does it hurt to hold your hand in one position for a long period of time? Does the discomfort occur constantly, or just every now and then? Your doctor will probably want to take x-rays of your hand to make sure that you haven't fractured your wrist or have another condition such as arthritis. You may then need to take a flexibility test or perhaps have electrodes placed on your wrist to measure muscle and nerve conditions. Just what will your treatment be? Well, basically, there are two options. The first treatment program usually consists of wearing a wrist splint. This splint may be worn at night or during the day while you're working. The night splint helps keep your wrist in a safe position while you sleep and minimizes nighttime pain. Day splints are known as occupational splints because they're designed with a specific task in mind. The splint designed to protect a painter's wrist will look different from one designed to help a typist. Nevertheless, each splint will cushion the wrist, protect it from further injury, and keep it in a neutral position during the workday. The second treatment option for CTS is the use of medication. Medications are used to reduce the swelling and inflammation, thereby relieving the pressure on the median nerve. The medication may be either injected directly into the carpal tunnel, or it may be taken in pill form. Sometimes both splints and medications are used at the same time to help reduce the pain of CTS. These simple treatments are usually all that's needed to treat the syndrome. However, if these treatments do not prove effective, then surgery may be necessary. Surgical treatment consists of a procedure known as carpal tunnel release, in which the transverse ligament is cut, allowing the flexor tendons to expand and ease the pressure on the median nerve. This option is always a last resort. It's usually reserved for those patients who have excruciating pain or the threat of permanent nerve damage. A hospital stay and rehabilitation therapy are necessary. Despite all the treatments we've mentioned, prevention is still the best treatment of all. If you take the time to protect your wrist and to find out how you can prevent any damage to it, you'll be well on your way to avoiding the pain of carpal tunnel syndrome. Take a few minutes to think about how you do your job and how you could be more careful. Ask your supervisor about your company policies and procedures, and don't forget to play it safe at home as well. Think about how many things you do each day with your hands. Could you afford to lose the use of them? Don't take that risk. Start thinking about and protecting your wrists. If you don't do something now, your hands may have some painful reminders for you later on.